here we are, another live Q&A with me. I'm Dr. Vyvyane Loh, and today, special show. I'm really excited because I have with me my very good friend, Dr. Carmelina Luongo, and it's a pleasure to have her here because I've been meaning to get her on my show for a long time. She's actually on vacation. So you can tell she's a really, really, really good friend because she's on vacation and she has like the busiest schedule because she's in OBGYN, right? So she's not just GYN, she's OB. So they don't get much sleep. And on her vacation, she's on this show. So Carm, thank you so much for joining me.
Well, thanks for having me, Vyvyane. You are a dear friend, and anything I can do for you.
Oh. Yeah, and I have Jean also joining us. She's said hi on the comments. Jean, how are you? And I'm glad you're on the show and you get to meet my very good friend. And I hope you'll get to know her better through this hour because she and I always get into these amazing conversations. And sometimes I think I've told you, Carm, I've said, we should just tape this. It'd be a show. And I've often said to her, we're the click and clack of the medical world. So if you know car talk, you know what I'm talking about. So Carm, let's start off because we've had many conversations about, women's health, metabolic health, right? So you're a very busy OBGYN and, day in, day out, you see all kinds of conditions in women and you see them across the lifespan. So what do you think has been the biggest, health challenge and the biggest scare for you as a physician, looking at women's health?
Well, I've now been in practice out of residency for 26 years, and it is really surprising to me how much of our population, like our weights, have really increased. Our BMIs have really increased. That and it's worrisome because I feel like it's become more difficult for people to be at a healthier weight, and it seems more of a struggle, and it starts earlier. And I wish we could do something for people, especially starting at a young age, to put them on the right path, because it's such a struggle. It's shocking. I'm sure some of it is medications like antidepressants and maybe steroids, but I think we really have to try and, as a society, I don't even think it's just something a doctor can do anymore, is help people be eating healthier, living healthier lifestyles, because it's really impacting their lives.
Yeah. And you've, seen a lot of the younger women also at, kind of the start of their lives, right? Having all these metabolic concerns already. And, for my episode on menopause and fat, you had asked me to talk about fatty liver, which kind of struck me. I was like, wow, she's really concerned about this. This must be something that she sees a lot of. So is that true? Is that what you're seeing a lot of?
I cannot tell you how many young people under 30 come and tell me that they had elevated liver enzymes on a lab test, and their doctor does an ultrasound and tells them they have fatty liver. And I tell them, didn't they tell you how you could try to reverse this? And they said, oh no, I thought it was a permanent condition.
Ooh.
I just want people to know that we have to try to treat this because it's becoming the most common reason for a liver transplant. And that's
Right.
so, I mean, you need your liver. Your liver is what detoxifies your blood. And it's so dangerous that we're eating so much food that stimulates our insulin, that we're storing so much fat in our liver that we're replacing the good cells that do all the detoxing. It's really scary. This is something that we never heard of in medical school. Like, we'd
Yeah,
never
not to
heard
this
of it.
extent. Yeah. Now, so Karam, why do you think their doctors aren't telling them it's reversible? Or it seems like that. I don't know if they're telling them, but it seems like they missed that message, right? Somehow.
Well, I think when I talk to some doctors, they think that people are not capable of changing their
Mm,
behaviors. And I don't believe that. I think
yeah.
we just have not taught them, and shown them the way. And that they're also very hard on themselves. Patients feel like, oh, I failed that, I can't do it. That's not true. You just have to try a different way. Maybe you have to understand how serious fatty liver is, and that you can do something to change this.
So what happens when you tell them that it is reversible? Like when you say, "Did
They're
no one tell
they're
you?"
they're so shocked. They're so shocked. And I
Wow.
talk to them a lot about that. We always think of sugar as such a sweet little thing, that they don't understand that all the glucose, the sugar in our food, is killing us. I tell people to think of glucose and sugar as glass shards cutting at your arteries and
Razor blades.
razor your arteries and making damage, that then the way it heals is like all this cholesterol sticks to it, and how we're damaging and to think of sugar that way, and not as, oh, a lollipop or a little sweet or a little treat. That's how you have to think of sugar. And you have to think of sugar not just as in candy, but as in flour. And you really have to think of it as something that when I take that, just like when I drink alcohol, I am doing some harm to my body. But
Yeah.
I and people don't see it. Like, your salad dressing's full of sugar,
Yeah.
your
Oh,
Chinese food is full of sugar, like that you order, like sauces have sugar,
right.
and you have to slowly detox yourself from it.
Yeah. Yeah. Okay, you can see why we're friends, right? Because we use the same language. S- Destroying your blood vessels. That's how I describe it to my patients too. But it's the truth.
It is. And I think people, I think they have to start slow. Like, first you eliminate the obvious culprits. Just eliminate some desserts and sweets and sugary drinks. Start there, and to give yourself time, because this, you're trying to become healthier. You're not trying to become a supermodel. And see if you can get used to that, and then slowly you start looking at other things. And it's not like you can never have a piece of cake, but that should be really like a monthly treat, not an everyday or an every meal treat.
Yeah, it's
And
hard for people to see it that way.
eat less of it. You'll crave it less. It'll also, you'll learn your appetite. You'll want nutrients. I think there's different ways to battle it, but I am telling you that I mean, I've had patients for a long time, and I've had patients that were a normal weight that 10
Mm.
years later are 100 pounds heavier. And
Mm.
I do believe that sugar is the enemy.
Yeah, yeah. So across the, let's just start with GYN spectrum, right? Across the GYN spectrum, what complications or comorbidities do you see with that?
Well, I do think that we see that as people get very heavy, that they're more at risk for polycystic ovarian syndrome, uh, that they are, and that can affect their fertility.
Mm.
And so I think that is really something that is a problem. Also, we see that when you have high estrogen states, we've seen now the rate of endometrial cancer really increase over the last like 20 years. It's like the GYN oncologists are talking about it. They really want women to lose weight because the rate of endometrial cancer is so high, and it is definitely associated with obesity. And
Yeah.
that's been rates of breast cancer, same thing. Obesity
Yep.
increases those rates. And so I think, women really have to work hard at reducing that.
Well, here's the thing, right? Sometimes doctors are afraid to use the word weight and to talk to their patients about their weight, right? Um, and that's that whole not wanting to fat shame, which you and I both know that's the wrong thing. But not telling them that they have something that's putting them at risk for endometrial cancer that could basically end their lives, right? You know, I don't know. I think that that's unconscionable.
I just try, when I see people, see where they're at, how they feel. And I think patients are frustrated. I think that is really the truth, that they feel like it's impossible for me to lose weight. I don't know how to lose weight. I feel like I've tried and I lose weight and I regain. But I think we really have to go back to um, slow and sustainable changes, and
Yeah.
to look at, and it's going to take a long time for people, because I think they want their cake and eat it too. They want to be able to have all the processed foods, and they want to have all the desserts and have a healthy weight. But I don't think that's going to work, because you have to think, like, 70 years ago, we didn't have as much processed food. You weren't eating like that. And
Yeah.
that has really impacted us.
Right. And the availability, right? It's just anywhere you go, you can just walk into a store and get all. You didn't find that, 50, 70 years ago. It
I
was a
mean,
lot harder.
look at places like third world countries where, like, when I don't know, just other countries that didn't used to have places like McDonald's, and now they have McDonald's. These countries never had any obesity, and now they have obesity, right?
Yeah.
Like, we see this all over. And
Yeah.
it just goes to show that those foods have changed the palate of the human being. It's wanting us craving, we're craving sugar, and we're just eating it. And that now we're seeing obesity in cultures we've never seen it before.
Yep. Absolutely. Well, that had a much healthier lifestyle, right? I
Right.
just want to point out that Maya and Jean are on, and anybody else that's on, feel free to type a comment or questions for myself or Dr. Luongo. We'd be happy to answer it. And while we're waiting for those questions, come. Okay, we just talked about GYN, some of the complications, but actually, it's when you told me about some of the OB stuff that I hadn't even thought of. I really hadn't thought of with obesity and pregnancy. So, one of the things you told me was just about the weight that is basically, in many cases, crushing the baby's head. That I had never thought of. I was like, oh my God, I never thought of that weight on the baby, right? So, physically, that's one thing that you see. How
It's
often?
harder for babies to come out vaginally,
Yeah.
and because there's more tissue they have to compete with. The other thing is that uh, when you're obese and you are delivered through section, you have much, much higher rates of wound infection. And I don't mean like you just get some redness. I mean your wound coming open, and like having a DVT, which is a blood clot in your leg that can go to your lungs. We definitely see that they have higher risk of these things. They have higher risk of diabetes. And I would remind everyone that I always tell moms when they're pregnant, you are not eating for two. We don't want babies
Mm,
to be bigger than 8 pounds. An 8 pound baby
right.
doesn't need extra calories. We want you to eat nutrient dense foods. I tell moms they never need processed food, they don't need desserts. And that,
Mm,
try to be as healthy as you can when you get pregnant, and stay healthy. Because it really, and think about what is fat. Fat in our body is inflammatory. You're growing your baby in an inflammatory environment. And
yeah.
I think there's definitely, we see that. We see that it affects the moms. And don't get me wrong, like, you can be a normal weight and still have gestational diabetes, but we definitely see higher rates of gestational diabetes. We see a higher rate of
Mhm.
hypertension. I see, when I was training, this was a small part of a obstetrical population. Now, I feel like most of my patients have gestational diabetes or
Wow.
hypertension, and these things do affect the baby that we're growing.
So back in the day, we used to say that was high risk, but now everybody's high risk, right? I mean, essentially, that's what we're saying,
Oh, if we sent all these people to maternal fetal medicine doctors, they would be overwhelmed.
right? It'd
There's
be
so many.
everyone. Yeah, yeah.
Yeah.
And then besides the wound infections and the wound opening up, also you told me the bleeding risk is high when you're doing a
Yes. There's more
C-section.
tissue. There's more tissue. It's harder to get the babies out. You need more help. Uh, I definitely think it's harder.
Yeah, and I know, we've had conversations where you've told me, like, sometimes you in a situation where a baby isn't doing well and you have to be quick and you have to get the baby out, right? In those circumstances, there's a lot of bleeding. It's harder to find the uterus. There's a lot of tissue in the way to get the baby out quickly and
Right. It's
safely.
it's harder for anesthesia to put in spinal anesthesia. It's harder for them if they have to put you to sleep in an emergency because your airway is more swollen, there's more tissue. It is. And we think about it. We actually, people who have a BMI more than 45, we have to get an anesthesia consult to see if they can be delivered at our hospital. It doesn't have to be at a different hospital that has more anesthesia people on hand.
Wow.
So,
Wow. That's eye-opening, Carm. I'm so glad we're talking about this because, again, no one talks about this, right? It's like, oh, you get pregnant, you have a baby, but nobody talks about, okay, what are the implications
well,
if
we
you,
talk a lot about that the maternal mortality rate has increased
yes,
since I finished my training, which
yeah,
seems incomprehensible. How could we be a more modern society, yet more women are dying in childbirth? But women have gotten sicker. They've gotten
yeah.
more obese. And when they've gotten more obese, they have more diabetes, they have more hypertension, they're older. So it people this is not the women who are giving birth today are not the women of the 1960s and
Mm,
70s and
mm,
80s.
mm.
And but I blame society too. I blame big food pharma. These food companies, they don't have our health in mind at all.
No.
They want to make money, and I think that they have, and they've invaded our school lunches, and
Yep.
they've made our children unhealthy. And but women, we can take it back. We can we can eat differently, and I promise you that if you eliminate some sugar in your life and ate real foods, you would naturally slim down.
Yeah. And Karma, because Maya is a med student, that I found out through her, they're still not teaching any of this in the med school curriculum, right?
I think we are taught almost nothing in nutrition. Everything I've learned has been mostly on my own.
Yeah.
It's
Okay.
it's
So
not been through
see,
school.
you're vouching, okay? Because I skipped a lot of classes, so maybe I just missed the 30 minutes we got. But you went to all the classes, right?
Yep,
And they didn't do. I don't think they did even an hour, did they?
I doubt it.
Yeah. Anyway, it was forgettable. It was so forgettable, none of us remember it, right? And it wasn't anything that we can use with patients.
I think too back then it wasn't as big of an issue. I don't know. You can ask Maya. Do they teach more on nutrition now than they did
No,
30 years ago?
she gave me a sad emoji, and then she
No.
said, "Yeah, unfortunately." Mm-mm.
Yeah.
Yeah,
Yeah.
same,
Because now it's a big issue. It's a big issue.
yeah,
But how do we get our voice out? We have to compete with food companies who want to sell their products and make money. How do we teach people that you have to eat real proteins and real vegetables and try to stay away from sugary things that they're really bad for us?
what
I don't
happens when
know.
you tell your patients that, Carm?
Well, it's not easy. I really encourage them to explore and try different things. And I think a lot of patients really do want to be healthier. I do. And, but it's a struggle. And I also tell them that sometimes everyone can have all the knowledge and still struggle to lose weight. And sometimes they have to deal with psychological issue that they use food as a way to deal with stress or joy or comfort. And I understand. I tell them, of course, a bag of potato chips is better than a snort of cocaine. I mean, don't get me wrong, there are terrible things, but like I always encourage patients who are going to go for weight loss surgery to go to therapy. Make sure,
Yeah,
because once you've had that surgery, you cannot use food as a way to cope with things. And you should be able to understand and have someone to turn to. Because I have had patients who've had weight loss surgery who've become alcoholics because now they couldn't eat when they had pain
yeah,
and
you
stress. They
told me
drank,
that. Yep.
or they became gamblers, or they became addicted to shopping. So I do really think that that's part of it too, that we probably have a lot of pain in the world, and we use food as medicate it, and it's not good food. It's usually not carrots or celery, or it's usually like processed food. And I think that that's another issue too, that we have to deal with that part also. But we have to also accept that we have to eat differently. It's
Yeah.
a hard realization.
Yeah, it's true. I think there's that, a little bit of like fantasy land, right? That we can have whatever we want and still get the results that we want to get. But the truth is, if if you do what you did before, you're just going to get the same results.
Right. I mean, for you, um, like, what have you found has been most helpful in helping people have long-term weight loss?
Oh, Carm, you know what? It's exactly like you said. First of all, people are not aware, or maybe they've given up hope, right? Because they've tried it. I think you've seen that, right? People lose hope because, oh, Dr. Longo, I've done this before. Every year it's that yo yo. I lose 10 pounds, I gain 10 pounds. I lose 10 pounds, I gain 15, and it gets worse, right? So I think usually when I see my patients at the first visit, they feel like, oh my God, is this ever going to work? And they kind of feel demoralized already. But the other thing is there's so much confusion out there, Carm, with like the messaging that we give around food, right? And because a lot of that messaging also is kind of how to say contaminated by the food industry, right? So the food industry will put labels that will say heart healthy when it's not. I mean, I don't even know why we allow that, right? So I've, I have had very, very intelligent professional people, top of their field, and they go, oh, but it's, cereal is heart healthy. And because it has that label on it, that stamp on it, right?
Right. Can you believe that an ultra processed product is considered heart healthy?
Right. But
That can tell you that the American Cardiac Association has been bought out. Bought out.
yeah, because,
Yeah. Why
why
would
would
people
you say
believe
that?
why would people believe us? You're right.
Yeah. So, now they're like confused and okay, cereal has that stamp, right? And then, oh, trans fat is bad, but you should have margarine. Do you know that? That's what they're recommending, margarine. Well, isn't that like a trans fat that's supposed to be so fat, bad for you? American College of Cardiology. So now we're like, oh, what do we do, right? So that's what patients are confused about. That's number two. And then number three is it's really hard to sustain the new behaviors. You start off, you have good intentions, and then after a while, life gets in the way, right? You got two kids, your work demands are piling up, right? You're tired. You have all kinds of responsibilities, and now it's really hard. Oh, what was I? Oh, I was supposed to meal prep. It gets harder and harder, and it's easier to just eat out, right? Order out, whatever it might be.
But that's why I think people have to have slow systems. I think, like, one rule I have is I weigh myself every day. Like, I mean, I'm on vacation, I don't have a scale, but other than that, I weigh myself
She
every day.
does. I know her. She does.
And I think what I tell people is, like, it's you may gain 5 or 10 pounds, not know it, but if you're getting on a scale, you know it. And when you see yourself gain 5 or 10 pounds for whatever reason, you say, okay, I've got to lose it. But if you don't get on a scale, it could be like 20 pounds. And I've literally seen patients, I'm like, did you anything happen this year? Do you realize like your weight changed? And they'll be like, well, what happened? I'm like, well, you gained like 25 pounds. And sometimes they don't even realize it.
Yeah. And then also, I've had patients that don't want to know their weight. I don't know if you've had.
I tell people, well, I know people get very upset about that. And I say to them, it's not like anyone in the office is going to remember your weight because we see hundreds and thousands of people a year. It's also for you. I find sometimes when people uh, have seen a jump in their weight, it motivates them to change things.
Yeah. Yeah. But I think that not wanting to see is a bit of avoidance. You know what I mean?
It doesn't help. I just tell people it doesn't help. It's better to be honest with yourself and then to see how you can make changes to, lose that weight. Some people say, oh, I said, you may lose and regain the same 10 pounds, but at least you didn't gain like 50 pounds.
Yeah, that's true. And I was just reading a study that was saying that even though people yo-yo diet and get their weights go up and down, that over the course of let's say several, over 10 years, that they still are healthier, right? Even though they've lost and regained, that time that they lost, even if it was a short time, was protective, right?
But also I feel too, because they at least have tried to lose, they didn't get to a higher level.
Yeah.
Because I
Yeah.
do feel like when you get to that higher reset, it's even harder to lose.
Yeah.
So it is important to try not to let yourself gain weight. Sometimes I tell my patients, if you feel overwhelmed, maybe the first thing you do is say, I'm not going to gain weight. Start there. Just try not to gain weight for a year. That sounds crazy to some people, but I say sometimes that's hard enough too. Just try not to gain weight. And then you can slowly change your habits. You have to understand that what got you here
Yeah.
is not helping you.
No,
It's
Carm, that's such great advice because a lot of times people say, I have patients, I'll see the first time and they tell me, oh, I want to lose weight. And then, I'm getting my master's in this and that, right? And I'm going to night school, but I'm working full time. I have 3 kids. And I'm like, whoa, 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 whoa. You know what? When do you graduate? Oh, in a year. How about we focus on keeping your weight stable this year? Because you got 6 million things. And then when you graduate and your eldest one goes off to college, okay, one off your plate, right? Maybe now we can focus, but let's give this year the year of just keeping stable because that's realistic and you don't set yourself up for failure. You know what I mean? Yeah, that's okay. Jean has said that she totally agrees. So, people listening in or watching, put in the comments what some challenges are that you have faced with kind of being healthy, maintaining your weight, keeping your healthy habits. What are the biggest challenges? When do you find that you do pretty well, and then you get to a point where you get into trouble, and what would be helpful to get you back on track, right? Because a lot of times once you go off track, it's so demotivating that it's hard to get back on track.
I think people make it too hard. I think they have to find um, being healthy easier. Like I tell
Yeah.
people, don't do a physical activity that you hate. You're just never going to maintain it. I mean, it's okay to try new things to see if you would like them. But if you're like, I hate doing CrossFit, don't do it. I mean, that's just not going to work. Find a way to be more active. Try to, carry, like if you love gardening, great. That requires a lot of weight bearing exercise. Do things like if you like dancing, go dancing, but don't do things that you hate. I feel like they don't maintain them. And then it's just like you're setting yourself up for failure.
Right, and then it becomes misery. But along those lines, I get so many people, Carm, they're so like ambitious. They want to meal prep all these meals that like when you see in the magazines, they look amazing and they're all laid out and everything,
No,
and then it's too much work, and I'm like, yo, have some healthy yogurt. Why don't you like just boil some eggs? Because even I can boil eggs, right? You taught me how to do the zoodles and
right.
they're delicious, right?
Easy, right?
Yeah, I
Five
was so
minutes.
proud of myself. I shocked a lot of patients, Carm, because when people ask me how to cook them, I actually could tell them because Carm knows I don't like to cook, but she's like, "Look, Vivian, all you do is this," and
Right. I
you,
just got the handheld thing. It cost me $5 on Amazon. I just spiral a zoodle, saute it in some little bit of garlic and olive oil and salt and pepper, and put anything you want on top of it.
I know. So normally I microwave a lot of things. So this patient asked me, "So you microwave that too?" And I said, "No, no. Actually, my friend taught me to saute it." They're
That's
like,
why.
"Oh, that's a great idea." I'm like, "Well, it wasn't mine, but I know how to do it now."
Yeah, I think people just have to make it easy. I say don't make like buy. I buy like you can buy. I mean, choose your protein, but like I buy these little chicken that
Yeah.
strips raw chicken. I just grill up like a
Right.
bunch a week, put them in the fridge. The kids can make a salad with it. They can put it in a taco. They can just take it and warm it up and eat it. And but you have to have food that like when you're hungry, it's there to eat, but don't make
Yeah.
it hard. Don't make it
Yes.
too
I think, yeah, some people do the Martha Stewart approach, they grow their own chickens and then now like, you know what I mean? It's like, okay, if you can do it, that's great, but that's a lot of work.
right. And you don't have to make it so hard. Use your crock pot, so easy. Throw food in there, leave it, come back from work at night and it's there and it's so easy to make that healthy. And you don't have to invest in a lot. Like I tell people, like in my house, we have a philosophy. Like my husband cooks on Monday and he makes enough to have leftovers on Tuesday. I cook on Wednesdays, are enough for Thursday. Friday is usually, I mean, I don't, it's pizza night, but I tell people you can have a slice of pizza and have a big salad. You don't have to deprive yourself, but be reasonable, be reasonable.
Yeah,
So I
and your kids are eating healthy. Is Gianluca still eating protein?
absolutely. And you stayed at my house and like, right. We do it. So like if someone, like I can make a meal and there can be pasta and rice, but it doesn't mean that I have to have it. I can choose just to have more veggies. I think you can do that. You make your protein, you make your veggies, you decide if you want that starch or not. I mean, I'm not saying the kids can't have it, but I try
Well,
to minimize.
ever since I've known you, Carm, you've eaten, you've eaten very healthy. You've never been a
I
huge
feel
processed
I,
food person.
I haven't, but I feel like menopause has definitely made it more challenging to be healthy. And I'm working harder at really minimizing sugar, flour stuff in my diet. I feel like
Yeah.
that's my next goal, to really, really minimize that.
How's the resistance training going?
Good. I could be better, but I do have weights in my living room and I do have weights in my basement, and I try to lift, I would say twice a week. That's the truth.
Yeah, that's pretty good. And
Mm,
like you said, do you like it? Do you like it? Maybe you could find something else that works.
yeah, I know it's very important, so I'm definitely going to do it because I mean, the data shows that exercising is the fountain of youth. That is, keeping yourself strong is what's going to get you to your older age feeling healthy and be able to do what you want to do. So I tell people, find things you like to do, because the people who are physically active, I don't say be an athlete, but if you got that, you got your muscles and you got some cardio and some balance, you're going to outlive and live a happier old life than if you don't do those things.
Yeah, and I just want to tell everyone, like, Carm is an OBGYN, and like she's on call. When she's on call, yeah, she's most nights that she's on call, she doesn't get to sleep much. And she comes back and she's like, okay, I won't describe how you look like, but
Oh,
you get on that Peloton, you work out, you still take care of yourself, right? And I'm like, okay, yeah. Well, that's like one of the busiest schedules I've seen, your mother, So, and you make it a priority too. So I think it's a good model for your patients too, Carm.
I say make it simple. I'm from the good enough theory, and I have to say too, if you don't take care of yourself, no one's going to take care of you. When you're a woman, you have to take care of yourself. You have to, you have to move. You have to lift some weights. You got to try to eat healthy. I'm not saying it's easy. I'm not saying I don't struggle. I think everybody struggles, but I feel too like I don't do things now. Like I'm at an age, I don't do things because, oh, I need to look good on the beach. I do them so I can feel healthy. If I don't do this stuff, I have a lot of aches and pains. I don't feel as well. I feel more stress. I think women should focus on that. Like in doing this, I think you feel better. If it's not making you feel better, then you're doing something wrong. You should feel better when you eat healthier. You should feel better when you exercise.
Yeah, absolutely. And the thing is, like you were saying, so many women that you see now, you have to counsel them and you have to tell them about, um, eating healthy. And it's just kind of weird because we have a shortage of doctors, right, Generally. I mean, you know about that. I know everybody's feeling it, right?
No CP. It's rough out there.
Yeah, it's really rough. So, okay, shortage of doctors. I got people who are waiting 3 years for primary care, right? Okay. Yeah. All right. So now people are getting sicker. Okay. So why are we not prioritizing this? Because most of these chronic diseases are unnecessary. We don't need to have them.
I think we have to change society. I mean, it's complicated. I think that um, we should not allow the foods that are served in our schools to exist. That we
Yeah,
No, really.
I know.
How did chicken nuggets become healthy?
I know.
Like the food that they feed in elementary school be considered healthy? It's not. And a lot of our children, that's where they get their meals. We have to do that. We have to make the kids more active, because remember, we lead more sedentary lives. We work on computers. We're not farmers like we used to be. And I really think that we have to teach our children, because I do think, I don't know do you know the statistics, Vivian, of people who are like, if they're obese at puberty, like at 16, how many of those end up ever losing weight and being a
No,
normal?
very few. I think most of them end up, I want to, it's off the top of my head. I knew that statistic once, but it's high, Carm.
And
It's
that's what,
it's greater than, definitely greater than 50%, and more like maybe the 70 to 80%. They will be overweight and obese in later life. And then at pregnancy, right? And then now at menopause. So like this is like compound interest in terms of
right. So, because
debt,
women really do have to watch themselves, because pregnancy is a time of weight gain, menopause is a time of weight gain. And so it just, that's why it becomes more difficult for women. And that's why you have to really watch yourself and be careful.
Yeah. Actually, yeah, put it like that. I didn't think of it that way, but to say, yeah, for women, actually, puberty is a time for weight gain, right?
Right.
Okay. And then pregnancy is a time for weight gain. And then menopause is a time for weight gain. It's rigged against us.
It
So,
is. But we can't like just close our eyes and pretend it's not happening. Like even when people are pregnant, like I try to tell them, the first half of your pregnancy, which is 20 weeks, you only need to gain like 5 pounds to be healthy. And people are astonished by that. And then from that until you deliver, it's only a half a pound to a pound a week. Most people shouldn't gain more than 20, 25 pounds,
right.
but most people exceed that.
What do you think? What's the average weight gain during pregnancy, Carl?
I 40 pounds easily.
Whoa. So easily double.
Right. And you only lose about 20 to 30 pounds at most from delivery, at most. So most people, when they, after they have their baby, have 10 to 20 pounds to lose. And I tell people, who wants to go running when they're getting up 4 times a night to feed a baby?
Yeah.
Nobody like lose weight. They're exhausted, they're breastfeeding, and they're tired. They don't feel like themselves. So I know it seems discouraging, but I really would encourage people not to be like, I'm eating for two, I can eat whatever I want. I tried gently. I mean, I had a patient once who left me because I talked to her. She was like 22 weeks pregnant and she'd already gained 40 pounds. And she was mad that I was bringing it up. And
Hmm.
I said, I'm trying to help you because I know what it's like. And don't get me wrong, there are some people in the last month of their pregnancy, they gain a lot of water weight. That's different. That you will lose.
Hmm.
Sometimes you can't help that. It's the hormones. But early on, you have to really, understand that it's not good for your baby.
Yeah. So Jean says that she gained 50 pounds for both your kids. Was that hard to lose, Jean? Was that hard? Because I can imagine, just like Carm said, that now you have your kids, you're on this feeding schedule, right? And everything's topsy turvy. Your whole routine is like gone, and you're recovering from delivering. So, let us know and how it was, afterwards. And yeah, she said it was hard. Yeah, and then you're trying to raise your kids with this extra weight, right? So it's really, really hard. What are some of the things you tried, Jean? And what do you think is helpful or not helpful? Hell, she had a lot of Oh, okay. Was that during the pregnancy, or did you? That's from the you had some water from the pregnancy, so you were one of those people who swelled up a lot.
Yeah. So like usually you lose a lot of that water weight by 6 weeks after you deliver.
Okay.
Because
Yeah.
there are
See.
people who I feel like in the last month they swell up a lot. That's not real weight. That's not like fat. That's like water weight. That's different. But, you know, that
Yeah.
I think will lose. Like that just happens to some people. But
Yeah. Okay. Yeah. Okay. So she's saying that she's one of those that swelled up a lot. Yeah. It's really complicated. And then as you're raising your kids, now you're busier than ever, right? So you're more likely to keep the weight on that if you didn't take it off, or put on more because you're stressed now and you have less sleep, right? That's the
well,
other.
I would. I'd also encourage people, like, I think when people have children, they really want to set good examples. So I think this is a really good time to, like, maybe clean up your eating and, like, think about what are we feeding our children, you know?
Yeah, yeah, and it starts in the womb, right?
Absolutely.
Yeah, because I mean, basically, you're thinking about the nutrition. Whatever you put in, that nutrition is your baby is relying on it because it's not getting it from anywhere else, right? Can't
Yeah.
do, any like delivery. You're it, mom. So you have to be the one kind of making those choices that will, be the best for the kid's development, your child's development, right? I think, yeah, those are some of the important things that people instinctively know. Oh, even if they've had that habit of smoking, they really do make an effort to stop, or they stop the alcohol right around pregnancy.
I think I would say like 95% of people completely stop smoking when they're pregnant. I do see that. I
Okay,
do. Um, I I think that the eating, I don't know. I hope.
that
I
one
think
time.
there are some people who really try. I do. I have patients who do such a good job, and I say, look, you could do this while you're pregnant. You can keep these healthy habits going after you have the baby. Like you really can. Although I do think stress, if you're a stress eater, I think that's what help really sabotages some women after they have the baby because it is a stressful time,
Oh
you
yeah,
know?
yeah. You got to manage so many things that are different in your life now.
I mean, our college now, ACOG, the American College of OB/GYN, wants us to remind women when they're entering their perimenopause phase that this is a time of weight gain, to be aware of it,
Mm,
to be aware that it might be happening and to try to do things to combat that because that becomes a time where people gain another 10 to 20 pounds. And
right.
so I try to remind women that this is coming. It's not inevitable. You can try to do things so that that doesn't happen to you. Uh, and
But
and
what's
I
worse
think
is Yeah, what's worse is though, Carm, they gain actually more fat than weight, and that's because they're gaining fat, but they're losing lean mass, right, and losing bone too. And so now it's even worse because the body comp is worse, right? And I always say like menopause is when women become more like men metabolically because now you have the same cardiovascular risk as a man because you accumulate the fat now in the visceral compartment. We before menopause will have more subcutaneous fat, and then after that it goes into your organs, then all that liver fat that you were talking about, right? So that actually, so talking about liver fat, I know you see it in younger women, but actually menopause, that's why ACOG makes that recommendation, I'm sure. When you hit menopause, I mean, really, in women, we see now worsening of fatty liver, but also, the fibrosis now, more likely to have cirrhosis and stuff and bad outcomes from that, right? So
I know.
that's
I
the
think
complicating.
it's a time. It's a time. I think women have to focus after they have children to lose the weight they gained, and when they're going through menopause, really to change their habits to be even healthier, to maybe refocus on weight bearing exercises to keep their bones and muscles strong, to not try to lose that. Um, but I tell people, I think the worst thing is people who give up. People who
Mm,
give up on, they just keep gaining weight and they say there's nothing I can do. But I don't think that's true. I think we should never give up. I've struggled with my weight since I was a child, and I always feel like I'm learning more about myself. And you have to figure out what works for you, and not to give up, to try different things. I'm not a believer that one thing works for everybody. Otherwise, that's the only thing we would all do.
yeah.
I'm not against surgery for people who feel it's very important, but I tell people that everything is a tool. It's not a cure all. It's a tool. And I've had patients in the very early days that had gastric bypass who regained all their weight because the smaller stomach wasn't enough. It's a tool. And that's why you have to do all the hard work. Why am I at this weight? Is it just because I don't understand nutrition? I don't know what to eat? Is it because I'm inactive? Is it because I use food as therapy?
Yeah.
And you have to be honest with yourself and to deal with it. And it does matter because uh, weighing more makes everything more complicated. Puts you at higher risk for multiple diseases. It makes surgery on you more complicated. It makes you more uncomfortable, puts more stressor on your joints, makes you have a higher risk for hip replacement, knee replacement. And also, fat is inflammatory, and being in an inflammatory state is not good for our health.
Yeah.
And and I think that um, I think that I don't like that now people use the word fat shaming. I'm not shaming anyone. I don't think it's healthy. I think that we really have to work on this. That it's becoming a problem for our society. I mean, think about what one of the generals said, that there's not enough people. They can't even recruit enough people to be in the army. It's becoming a problem for the defense of our country because people are so obese and so un um, fit that they can't even recruit people for the army. I mean, just think about that. That's how bad things have become on a national level.
Yeah. Yeah. I mean, the prevalence by BMI for obesity is probably 42 to 45% now, post COVID, closer to the 45% mark. But by percent body fat, it's around 90%. So, I mean, just think about this, Carm. You walk into a room of 10 people and nine of them have obesity by percent body fat, right? That's pretty scary, you know? And one of the things I wanted to ask you was, do you get a lot of questions from your patients about the new medications that come out, and what do you say to them?
Um, I have patients who've been on it. I say to them, my concern is we don't really have long-term studies on it, and I'm a little worried about what happens when you stop using these medications. I mean, all we know is people on, social media have been saying that they rebound very quickly, which is worrisome to me. Like, I mean, at least with gastric bypass surgery, many people do keep off a significant amount of weight, but for this, it seems like the rest of your life, you have to use a medication that costs about $1,000 a month. And I don't know if that's sustainable. I'm not sure. And I feel like I know there's a 5-year study going on, and I want to know, are there long-term consequences to taking this medication? Um,
Well, there is
it's
a,
weird.
a
Like, I feel
risk.
more concerned about the medication than I do about the surgery. Like,
Yeah,
it's
there is a known risk in humans. I know, in the beginning they kept saying it's only in animal studies, but actually, a study that came out early this year, um, basically you are at higher risk for thyroid cancer, and that
oh,
occurs at the 2-year mark. That there's a significant increased risk for thyroid cancer, and it's one of the reasons at the 2-year mark they stopped the medications. Right?
yeah, but what happens to all these people, Vivian, when they stop them? Do they regain all the weight?
They do, and sadly, the weight loss that they lose is a combination of fat and muscle. So now, when you regain, you and I both know, let's not kid ourselves, you're going to be regaining fat, okay? I mean, I don't know. People always say, well, it's muscle. No, it's not. Trust me, I've done this a long time. It's not, right?
Mhm.
And so now, okay, you lost muscle and fat. And up to 30% of the weight loss, we know from bariatric surgery data that around 30% of the weight loss is from muscle. So you lost like 30% of your weight loss is from muscle. Okay. Now, when you regain all that poundage in fat. Okay. So now you just made yourself more obese by percent body fat, right? You know what I mean? Even if you go back to the weight you were before. That's one thing. And then the other more concerning thing is also they've made recommendations for kids to be able to use it, right? So if you're 13 and above and you have obesity, yeah, you didn't know that. Yeah,
Isn't that amazing that they're willing to give children medicine, but we're not willing to feed them unprocessed food in school?
that's my girl, right? Seriously, right? You know,
I mean, people say it's expensive. How expensive is it to give kids real food and buy them a pair of sneaker every year and make them walk and run?
right? Versus the what,
Well,
$1,000 a month? Yeah,
yeah, it's because big pharma.
yeah.
Yeah,
So
I worry about this, and I feel too it's psychologically going to hurt people, right? Because they're going to have this weight loss, and then they're going to have that regain. I think psychologically it's really going to affect people.
Yeah, and it's also, I don't know, it's very, I mean, we just have such a really weird relationship with food, you know what I'm saying? Like,
I think, like I said, the processed food, I really think there's like, you're almost addicted to it. I mean, if you ate, like, what's a bag of Doritos? Is that like 1,000, 2,000 calories? I'm not really sure.
I don't know, I've
But
never had
right.
one.
But if we had like that many calories in chicken and broccoli, like we couldn't eat it. We couldn't eat it. But
Yeah,
you can
it is.
easily, people can easily eat a whole bag of Doritos. And that's the
And
problem. There's
and
that
still be
it's,
hungry. Yeah. Yeah.
that's right. That it's somehow the way it affects our brain, it's like it's an addiction. And I think that people really have to try to keep those foods out of their homes.
That's the thing I've been trying to get, look, it's hard to resist, so just don't even bring it into the home, right? And Maya's saying that vegetables are a lot cheaper than processed. Yeah, and personally, I use frozen vegetables
They're
because
great.
they keep their nutritional content actually better than the fresh
And then
ones.
you only take out what you need. It doesn't
Yes.
get wasted, you
Yeah.
know?
So in terms of cost, I find that using frozen vegetables is really cost effective also. So that's helpful. And then the other thing I want to talk about as we are coming up to our hour is this, like, OBGYNs, you end up doing most primary care for a lot of us, right? Because, well, you got to wait 3 years to see your primary care,
Well, we
right?
see people every year. We do have that continuity.
Yeah. And also, I think somehow, OBGYNs have a closer relationship, even in this age of, the computer thing where you don't get to really, do anything but stare at the computer and write notes about the patient, right? But I think in OB it's different because you actually are hands-on, you see the patient. And so I think patients trust you and there's a better relationship. And you end up doing a lot of the primary care work. But then you're also very busy. You're both OB and GYN, right? So having the time to do the nutritional counseling to help your patients because they come see you and maybe if you have a follow-up in 3 months, but generally if it's OBGYN, maybe it's a year, right? So they see you for that one period and then it's like bye for the next 6 months or a year. And then they come back and like you said, maybe they're worse off than they were when they first saw you, you know? So what are some things that you think would be helpful? Because, you've asked me many times, like, when are you coming here and taking care of my patients, right? So, like, as a very busy doc doing this kind of work front lines, what kind of things do you wish your patients had access to?
Well, I wish they all had access to therapy to
Yeah,
deal with like why they're eating.
yeah,
If they had some access to coaching
yeah,
where they could at least like what are foods you enjoy? How do we do them healthy? And to really and then maybe someone just showing them what are activities that you want to do that would keep your muscle and bone strength. And let's think of it as um, that we're not just going on a diet. We have to change our lifestyle. And what lifestyle changes can you conceive of doing? If you feel like I can only do this for a month, then forget about it.
yeah.
At
It's
least
not
try.
a lifestyle change.
And
Yeah,
maybe if I can't do this, this isn't working. Let's try something else. But if you don't change your lifestyle, if you can't do this for the long term, then you'll just go back. And
yeah,
sometimes it takes you time. It takes you time to realize like this isn't working. I have to try this. And to try and see what works for you. I do feel like there's different people and different things work for them, and I'm not critical of that. But I think you have to keep trying.
yeah.
Just because the Atkins diet didn't work for you doesn't mean it won't work for somebody else. And
And maybe some modification of it will be more
right,
helpful
yeah,
to you. You know what
look
I
for
mean?
ingredient.
Yeah,
Maybe you have to say, oh, I found an easy way to make this fit in my life.
right.
I just think people cannot give up. That's what's made me sad is I see people just give up. But I feel like the people who give up just keep gaining weight. And I tell people too, like sometimes people say, "Oh, she's just naturally skinny." But when I talk to my skinny patients, they actually work really hard
Yeah.
gaining their weight. They tend to eat lots of vegetables. They tend to exercise. Um, they really
Yeah.
work. So I actually find that there's very few women in their 40s
Right. That are
are
naturally, yeah.
they work at it. And that's I would want people to know that because I think they're resentful, but they shouldn't be because they're really working at it.
Yeah.
And you
I
can
agree. I mean, because that whole genetics thing, I'm like, yeah, I haven't seen it yet, you know?
like there's people are there girls in their like who are young, like 18, 20, that are eating junk food and are thin? Yeah,
Sure.
but
Yeah.
not
No. No,
no.
you're right. Not at 40. And like thousands of patients. I really haven't seen one that's genetically skinny. You know what I'm saying? They may
No.
even look thin, but they have a lot of visceral fat, have a lot of normal weight obesity, for example, right? So
Yes.
kind of like what you're saying. So all the things that you pointed out, I have in my program. So for example, we don't do therapy, but we do a lot of cognitive behavioral based sort of classes so that we can help the patients kind of process their thinking, their emotions. Why are you eating? Is this really hunger? What Because there's physiologic hunger and there's emotional hunger, right? You and I both know that the wait for a therapist now is longer than a primary care wait, right? And a lot of people don't take, they kind of have out of pocket, right? They don't take insurance. A lot of therapists don't do that now anymore. So really, the landscape has changed, but at least having something where people can learn how to manage their stress and learn how to kind of, have sort of more ways to emotionally regulate aside from food, right? So those were the important things that I wanted to put in my program, which we have in place. So they have to actually attend the behavior classes as well. And then there's nutritional information because, like you said, a lot of people don't realize that, oh, it's not. I didn't add sugar to it, but there's sugar in flour. There's sugar in the batter of whatever foods that fried foods that you may be having, right? So just getting that information, clear information that's not confusing or conflicting or sensationalized, like real scientific information. And then around exercise, because like you said, hey, not everyone is going to be an athlete and do like, the marathons and the Ironman and things like that. And, if you're wheelchair bound, you're bed bound, there's still something for you. And there are many strategies. So I even use things like isometrics and eccentrics and stuff to help patients that are weaker and maybe they have some kind of limiting factor that will kind of interfere with regular types of exercise. But we got to find ways to work with people and tell them just because you have a limitation here doesn't mean it's the end game, right? And then having them have access to it, sign on online coaching, so that, because that's the other thing, you asked me earlier what is helpful is that you have someone kind of walk you through and guide you and support you through, right?
Right.
Because
We
what
help
we do, yeah, because
help
we give,
individual struggles. Like what are you struggling with? Help you figure.
yes. Yes, challenges, problem solving. Because again, we tell patients, oh, be healthier, do this, do that, right? And then we don't see them for 3 months, 6 months. That's a long gap where the patient's without any resources sometimes, right? So having someone just kind of say, yeah, okay, all right, you're flying next week. Here are some easy ways to have healthy meals when you're traveling, right?
Yeah.
Because I had to travel. To your alma mater. Yeah, I sent you some pictures. And yeah, I made sure I had, healthy, foods because I couldn't rely on, I know DC has lots of great restaurants now, I know, but I didn't know where I was going to land up,
Right.
what was going to be available. So I really prepped things, right? To make sure that, okay, I'm not going to be caught in a place where, okay, I have bad options, you know? So all those things um, are ways that we can help our patients kind of make it practical in their busy lives, right? Their real lives.
They can do it. Don't give up. That's what I would say.
I
Don't
know.
do things and be open and I really think people can do this.
You're such a good cheerleader. You're such a good role model too, Carm. That's what I love about you. And,
I
you know,
don't give up. I think that I know it's hard, but I think every time you're trying to be healthier, you learn something about yourself.
yeah, I certainly do. And I've
Right.
made lots of mistakes too, right?
I don't think
So,
mistakes. I think of them as a way of learning about yourself. Like, well, that's not going to work for me. But doesn't there's a lot of people out there. There's a lot of different strategies, and you can take the good from everything of what works for you, and you can learn about yourself. And you also have to decide what you're willing to do to get to that result.
okay. Well, Jean asked what kind of food I bring when I travel. So, you know what, Jean? Let's that's a great question. I'm gonna like make a memo of it. And the next live Q&A, we're gonna focus on travel, right? And actually, I hope we should do this click and clack thing. We're good together.
We're gabbing. We're all gabbing. That's all it is.
No, but you're also like we're always on the same page, and you always say it like it is, right? I know a lot of times we tiptoe around it, but you just don't have a problem saying, "Hey, this is what it is." And I always tell people our full-time job as doctors is to tell people things they don't want to hear. It's our job, but we have to do it in a way
Yeah.
they don't feel judged and they feel
Yeah.
that they can hear it.
About you. This is us helping you. It and for you to have a better life and to feel better. And how do we help you get there? That's
Yeah.
what it's about.
Okay. And Carm, so we're gonna wrap up the show, but you did ask me before the show, so I will send you information about our
Yeah.
program. And people, if you're listening in, it's Tulaversity, and it's TULAVERSITY.com, Tulaversity.com. And that will be live for registration on the 26th of June. So mark your calendars and you can sign up for that program. And in the meanwhile, thank you everyone for joining us. And like I said, I hope Carm comes back because you make my job so easy. It's just fun chatting with you. And thank you, Jean, Maya, for all your comments and your contribution. And I'm definitely going to focus on travel foods the next time. All right. So signing out. Yeah, she says thank you to both of us. So thank you, Jean. Signing out now from our live Q&A. I'm Dr. Vyvyane Loh, and we have Dr. Carmelina Luongo. Thanks for joining us. Bye.
Bye.